friends, welcome back to our channel. Today we are going to tell you about coronavirus. So let's get started. We are going to start a topic by spreading some information in reference to COVID. COVID-19 or coronavirus is a contagious disease. It outbreaked in Wuhan, China. COVID's first case in India were found in 3 towns of Kerela. The symptoms were found in 3 medical students who had just returned to India from Wuhan. The first wave was controllable, but the second wave, beginning in March 2021, was much larger than the first, with shortages of vaccines, hospital beds, oxygen cylinders, and other medicines in parts of the country. Common questions asked related to COVID. What is COVID-19? COVID-19 is a disease caused by a virus called corona. Most people with COVID-19 have mild symptoms, but some people can become severely ill. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions. What are post-COVID conditions? Post-COVID conditions are a wide range of new, returning, or ongoing health problems people can experience more than 4 weeks after first being infected with the virus that causes COVID-19. Older people and those who have certain underlying medical conditions are more likely to get severely ill from COVID. Vaccines against COVID are safe and effective. How does this virus spread? COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within about 6 feet. People who are infected but do not show symptoms can also spread the virus to others. Cases of reinfection with COVID-19 have been reported but are rare. COVID-19 spreads very easily from person to person. How easily a virus spreads from person to person can vary. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. What are the early signs of detection of the coronavirus? Symptoms usually begin 2 to 14 days after you come in contact with the virus. Other symptoms may include sore throat, headache. Common symptoms may include fever up to 99%, fatigue up to 70%, dry cough up to 59%, loss of appetite up to 40%, body aches up to 35%, shortness of breath up to 31%, mucus or phlegm up to 27%. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention. Calling in advance allows your healthcare provider to quickly direct you to the right health facility. This protects you and prevents the spread of viruses and other infections. Masks can help prevent the spread of the virus from the person wearing the mask to others. Masks alone do not protect against COVID-19 and should be combined with physical distancing and hand hygiene. Follow the advice provided by a local health authority. Why is keeping social distancing important? When someone coughs or sneezes, they spray small droplets from their nose or mouth which may contain the virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus. If the person coughing has the disease, even if they do not feel sick, the best way to fight the spread of the virus is to stay at home. If you must go outside or meet someone in person, make sure You keep a distance of at least 1.5 meter, about 5 feet between yourself and anyone else. Why is wearing a mask important? Masks should be used as a part of comprehensive strategy of measures to suppress transmission and save lives. The use of a mask alone is not sufficient to provide an adequate level of protection against COVID-19. If COVID-19 is spreading in your community, stay safe by taking some simple precautions such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning your hands, and coughing into a bent elbow or tissue. Symptoms in an image: headache, tiredness, aches, and fever. Maintain at least 1 meter distance. That's a precaution. Prevention: mask, distance, disinfection, gloves, hand washing, and stay at home. Can COVID-19 virus stay on different surface? If yes, then for how many hours? The virus of COVID-19 stays on different surfaces for different hours, such as that the virus can remain viable for up to 72 hours on stainless steel, 4 hours on copper, 24 hours on cardboard. How is COVID most likely to spread? There are several ways this can happen. Droplets or aerosols, or when an infected person coughs, sneezes, or talks. Droplets or tiny particles called aerosols carry the virus into the air from their nose or mouth. In which types of area does COVID-19 spread more easily? COVID-19 virus spreads more easily in crowded places, close contact settings, especially where people have conversations very near each other. Vaccine: Covaxin vaccine, Covishield vaccine, and Sputnik V vaccine. Covaxin vaccine. Covishield vaccine. Covishield vaccine side effects: Sputnik V vaccine. Sputnik V vaccine side effects. Now we are going to talk about the symptoms of COVID. Most common symptoms are fever, dry cough, and tiredness. And less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discoloration of fingers or toes. How can we prevent COVID? We can prevent COVID-19 by the following methods. Clean your hands often. Use soap and water or an alcohol-based sanitizer. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose or mouth. And the last, cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Thank you friends. Please like, share and subscribe our channel. Thanks for watching.